Hey everybody, today we're talking to Steve Bierman from California. So hi Steve, how are you?
Hi Justine, I'm great. Thanks for having me.
Cool, so I'll get you to just talk a little bit about who you are and kind of what got you into hypnotherapy, hypnosis and all of the cool things that you do. And yeah.
Yeah, happily. So I think the relevant part of who I am for this broadcast begins with me as a typical family practice physician. I did my family practice residency here in San Diego and stayed here because it's so beautiful. And found at the end of family practice that there were too many things I felt incapable of handling. And they were all the things that I've ultimately come to delve deep into and hopefully solve at least to some degree. But they centered around how to cure, and I mean really cure people, instead of just blunt beginnings and endless endings and traditional allopathic medicine and what seemed to me a real lack of wisdom and guidance on how to fix the very common problems that cause many of the ailments that we see in primary care medicine. So I just ran from that into the emergency room, where it takes very little justification to be an allopathic physician, because that's where traditional Western medicine works great. But even there, after a number of years, I found that I really needed more training, and I needed more knowledge and wisdom. You know, the emergency room, it's an endless pageant of people in pain and anguish and agonies of all sorts. Yeah. And it's also an endless parade of ailment after ailment after ailment, and with very little attention, if any, focused on non-material causes. So a series of events led me first to study neurolinguistic programming. I was very fortunate there to study directly with John Grinder, and John and I have remained friends for over 35 years now. And I owe a lot to him in terms of, well, in essence, almost everything I do, but how language is used, the impact of language on people. But I also then studied with Steve Gilligan, who was an Erickson protege. Steve lives up the road here just a few minutes, sorry. And I studied with him, and then I would go directly from hypnotic trance session with Steve into the emergency room, see 30 to 60 people, have a variety of people in various degrees of trance, and really learned a lot through that. And finally, then I've had a medical hypnosis practice here in North County, San Diego for well over 30 years, and seen scores and scores of patients and gradually honed my technique.
Yeah, awesome. And of course, writing your awesome book.
And then I published my book Healing in June of 2020.
Yeah.
And, I think more to the surprise of my wife than me. It's actually done quite well and been well received most places.
Yeah. So the people that you see now, what kind of people do you tend to have coming in with the?
Well, I've been here doing this for 30 years, so I have a nice referral network, and I have patients referred from non-medical healthcare givers, and from a host of local doctors as well, and mental health workers. So I see the full range of people, from very severe, say, psychiatric maladies, profound depressions, near-suicidal people, things of that sort. But I also see people with very, very severe, often end stage, quote unquote, I would never use that term, but often so-called end-stage coronary disease, cancers, autoimmune diseases, the full range of the usual medical diagnoses. What I find interesting about that, and it actually dawned on me just a few years back, is regardless of whether someone comes categorized as having a psychiatric ailment or a physical one, I find that I treat them all using the exact same tools.
Yeah, yeah.
And they get better.
Yeah. Awesome. And I know I'm reading, especially the parts of the book, how important language is when working with people. Can you talk a little bit about that?
Yeah. Well, it comes under the broad heading of ideas matter. And that, for someone I imagine like you, Justine, that doesn't seem very iconoclastic or revolutionary. But to a traditional allopathic physician who born, raised, saturated, imbued with, reductionist materialism, to even breathe that notion is heretical.
Yeah.
And so I'm concerned with two sides of the same equation. The ideas that the physician or authority, whatever their title, the ideas that they convey and the effect of those ideas on patients. But then also, and related, obviously, I'm very concerned with the deep and often unconscious ideas that patients harbor that are contributory factors in the causal chain leading to their illness.
Yeah.
Right. So on the first, I'll give you an example. Okay, this is a common thing that happens. It's happening right now while we're speaking in offices all around the Western world. Someone comes in and they have, let's say, a cold, and the doctor says, well, you've got a cold. There's really nothing anyone can do about it. Antibiotics are really for bacteria. This is what they're taught. I'm not saying that's true, because of course we know some antibiotics have antiviral properties, but this is the general spiel. And so the best I think you can do is take some acetaminophen and go home. And if you're not better in a week or two, give me a call. And so to me, that's an implicit curse. It's going to take you a week or two to get well.
Yeah.
Don't bother me unless you're worse, so on and so forth. And the consequence of that is that, I'll tell you how we know this in a minute, but the consequence is that they're going to have, in all likelihood, a more protracted illness than they need to. When you might just as well have said, it appears that you have a viral illness. I know you want an antibiotic. I think I have something that'll work at least as well. I'd like you to take this. And whatever this is, it's a placebo of some form. It can be an active placebo, some herb or other remedy that you feel or you have proof will help. But it's something, it's something tangible. And it carries with it the suggestion, the implicit placebo suggestion. If you take this, then you will get well. So you'd say to the patient, yeah, I'd like to take this. For some people, you have to be honest, for some people, it might not be that helpful. You can even say it's a placebo. This has been studied and proven. But for others, and then I'll go like this, perhaps just like you, you get a really rapid response, and don't be opposed to surprising yourself. Why don't you call me tomorrow and let me know how well you feel? And that's a different kind of send-off, but the consequences of using what I call the hypnotic lexicon and the techniques, which are underscoring or analog marking. You see me using my hand and my eyes and voice. All these things combine to make you use this incredible potent power that you have as an authority for the benefit of your patients, instead of doing the opposite, which is to curse them.
Yeah,
And
yeah.
certainly true. It's never, almost never, I would say, on purpose. Doctors just aren't taught the power of their authority.
Yeah.
The proof is, somebody would say to me, well, I need a double-blind randomized controlled study. And when I hear that person talking, I'm saying to myself, well, that person thinks he's a scientist by demanding that. Certainly, there are other ways to arrive at truths than randomized controlled studies. I haven't done a study, by the way, on whether I'm alive and talking to someone in New Zealand. I haven't got a randomized study on that, but I'm pretty sure it's true.
Yeah.
But we do have 70 years and literally tens of thousands of studies that prove this point. They're randomized controlled studies. You just have to read them right and see what the effect of placebo is.
Yeah.
And see that placebo, two parts of this. It has a therapeutic effect on patients, on average, like 25 to 35% across the spectrum of potential ailments. So we already know that. If you understand, as I believe I do, what hypnosis really is and what it's not, and it's not trance by any means, then you understand that the authority drives the placebo suggestion, which I mentioned. If you take this, then you will get well. And my authority, say, as a doctor, will drive that to actualize in a patient at least 35% of the time, 25 to 35. The other side of that same coin is that when we physicians, when we give medicines, we should be mindful that, as my colleague, Dr. Wayne Jonas has pointed out, we should be mindful that 60 to 80% of the therapeutic effect of that medication we're giving is attributable to its placebo content.
Yeah.
And so I spend a lot of my time teaching doctors around the world now, not just doctors, healthcare givers broadly, the importance of greetings and goodbyes, how to deliver dire diagnoses properly, how to give informed consent without defeating the patient, but rather inserting therapeutic suggestions along the way. And even how to do pre-surgical hypnosis so your patients can have bloodless, painless surgeries with really rapid convalescence.
Yeah.
So that's that first side of the equation.
Awesome. Yeah, and I remember the last time we caught up, we talked quite a lot about authority and what it actually does, especially from a young age. That'll be something cool to go into a little bit later. I remember I found that fascinating.
Yeah.
Yeah.
Well, we're all subject to it, and then the world has had a really good lesson in the power of authority. I'm here, of course, talking about the power of authority to shape your thoughts, because when I talk about authority, I don't mean like the authority of an expert. Oh, he's an authority on ancient Egyptian X, Y, and Z. I mean a biologic authority, and this is a primordial pattern. I believe it's hardwired in all humans, just as it is in the great apes. And what happens there is that there's a precondition. The subject has to be helpless and dependent, like a little baby is. And the authority gets recognized from all the others in the crowd. The authority is recognized by virtue of their absence of uncertainty or relative absence of uncertainty. That's what we scan for. That's a longer discussion why it's not certainty, but for our purposes, we scan for doubt. And when we see doubt, we roll that one out. We see doubt, we roll that one out. When the doubtless wonder rises and we're helpless and dependent, then we vest that authority. Yeah. We vest that doubtless wonder with authority and identify with them, meaning their thoughts, their ideas, their worldview, their ethics, their right and wrong, their reality becomes our reality. And of course, this happens in childhood. It's how we learn to walk and talk and, avoid dangerous things and so forth. But it's manifest around the globe all the time. Look at any demagogue, pick your favorite, and that's exactly how he's operating.
Yeah, completely.
Art,
And it goes back to,
sorry.
I was going to say that goes back to what you were talking about with doctors when people are coming in times of uncertainty, and the doctor is a certain one and passes on the information.
That's right.
Whether it be good or whether it be, like you said, the curse
Right.
that comes out of the mouth.
Yeah, I mean, and it's they walk in helpless and dependent. Their search is activated. It's instinctively activated. Let's say in this case, the physician before them is the one least uncertain, least doubt, maybe even haughty, and so he's elevated as an authority. That gives his words and gestures hypnotic influence.
Yeah.
And they best be careful, because as much good as can be done, and I think from reading the book, lives can be saved with this, and lives are saved with this every day. Similarly, harm can be done, and harm to the point even of death. How much time do I have, doctor? Well, the doctor doesn't know how much time. Everyone listening should know this. That doctor you're asking doesn't know his own tomorrow. How could he possibly know yours? That's an absurdity. The answer is, I don't know, but what I do know is this, and then you share true information and impart helpful suggestions. But if that doctor reaches out and says, oh, I feel so bad for you, the best you can do is put your affairs in order, at most you have 2 years, that's a curse.
It totally is. Yeah.
I have seen that kill people.
Yeah. I think I heard of a story once, I don't know how factual it is, where someone was given a misdiagnosis, but their body played out the symptoms and went through the process, and then after that passed on, they didn't have it. Have you heard that?
Yeah, there are several very famous tales like that. But we see test tube examples of this every single day. Let me give you a tiny one. Okay, seems tiny, but if you're a 3-year-old and you've been wrestled into an office to get an injection, and you're going to end up walking out with a lifelong needle phobia, it's not tiny. Here's what happens. You go in there and somebody says, well, we're going to give you a shot. And that word shot is already associated with a shot, which is a painful memory. Yeah. And then they walk around and they show you the needle and you're staring at this thing. And that visual is associated with a painful memory as well. And then the coup de grace is they'll say a little bee sting or a little prick. And so, of course, bee stings are painful. So they tense up, the worst thing they can do. And they take it. And of course, the self-fulfilling prophecy, meaning the curse, fulfills. And the doctor or the nurse or the other, ancillary people, they feel good because they haven't broken trust and they believe all shots must hurt. And so they did the right thing. In other words, their reality became the child's reality because they're an authority. Now, I, as an emergency physician for 20 years, I gave, a dozen shots or more a day, including wound injections and things like that. And I can say in the last 11 years, after I learned my techniques, almost no one, there may be a handful of exceptions, ever felt a shot that I gave. There's nothing inevitable about that pain. You just need to convey the proper idea. You have to believe it or know that it's true from experience, really. And then it's a simple thing of saying, I want you to, this is very important, so pay attention. Okay, now I'm the doc. They don't, if I'm saying it's important, they're going to buy that. I need you to look out there because I can't do everything. And this is important. I need you to look out there at that orange circle square and tell me whether that moves up or down. And by how much? Is it an inch or a half inch? Just look. And people in the hypnosis community, you know, just means and nothing else. So you put them in the visual modality exclusively. Of course, they're not going to feel. You could do the same thing, and I've done this one by saying, now I can't do everything. I need you to help me here. This is important. So now you've got them. There's going to be a peculiar sound. And I need you to, you might even want to close your eyes and just listen and tell me, not when it begins. I need you to tell me when that peculiar sound ends. Just listen. So now you put them in auditory exclusively, and boom goes the shot. It's as simple as that. It doesn't take any more time. But it's a test tube example, isn't it, of the opportunity and the curse.
Yeah.
And what goes on every day in every office all over the Western world.
Yeah, completely. I think I had a goodie of that. I had to get a little a CT scan thing, and I think they put the blue liquid in, and the lady had put a tiny little needle, and she said, oh, this is the wrong needle. This is really going to hurt because it's quite thick. And I couldn't get I knew what she had said straight away. And I thought, oh, that's not a good thing to say. And then I just couldn't get her voice out of my head. So it was painful. And normally I don't feel a thing. I would just put my attention elsewhere. But my brain just coded to, this is going to hurt. Oh, this is going to really hurt. And it just did.
I would say one of the jobs that everyone who's sensitized as we are can do is to proof people against those inevitable eventualities. So, for example, I would say to you, if I know you're going in, I'd explain, you know, the facts of the matter. Nobody can predict almost anything. It's a joke. Fallacy of prophecy is just, it's committed every day, everywhere. So I would spend a little time explaining that. And perhaps what drives people to feel they have to prophesy. But then I would tell my patient, realize this, whenever you feel a curse coming at you, however well-meaning or inadvertent or whatever, your mantra is, you don't know me. You don't know me. You don't know me. And you keep saying that as these things are coming in, and then they don't penetrate. Now I'm saying this to you, and you know what I just said is a suggestion, right? Because I have authority. So I'm saying then they don't penetrate. And that's what drives that mantra to actualize, right? I'm doing hypnosis without trance. I have the authority. And my suggestion is say this mantra. If you say this mantra, then their words won't have an effect. Yeah, so I'd offer that to everyone out there. If you have a patient, they're going to surgery, you best prepare them. Odds are the surgeon or anesthetist will misspeak. Get them ready for that so that they're protected.
Awesome. So do you teach this stuff online, your language courses and this medical stuff?
Well, as I think, you know, almost everything is in the book in terms of the first part of the equation, you know, how do we as caregivers do a better job getting our ideas across without cursing? So I do have day one of a 3-day course that I taught on, I think in 2019. The entire day is on YouTube. And so that gives people a good taste. And then there are some other lectures and things on there as well. And I teach courses all around the world right now.
Yeah, because it's such an important thing for people to learn and to know, isn't it? Especially in the medical and all these different professions.
Right.
Yeah. Oh, so when you're going, you're talking about the language and the first stuff. I think you were talking about the two different types.
Right.
just earlier, and then we were going to go on to the second part of that. I think I distracted you.
No. The second part is, what are the ideas that patients harbor that contribute to their illness? And early on, I think I even have this book. I'm going to show this to you. This is a great book. There was, he's gone now, Robertson Davies, a wonderful Canadian man of letters, novelist, essayist. And in this book, The Merry Heart, there's a speech that he gave entitled, Can a Physician or Can a Doctor Be a Humanist? And I'd recommend it to everyone. I think it's one of the most brilliant essays ever written. And while I was reading it, this is way back in mid to late 80s, a thought occurred to me. I thought, wow, what if I ask this one question, this particular way, to patients and see if that digs anything up?
Yeah.
Because if the way our ideas matter to a patient is our ideas become their ideas. So it only makes sense that their pre-existing ideas would already have some sort of influence on, you know, their state of health. So I started asking this question. I'll tell you I think I've told you, but for your listeners, I went into the emergency room. It was a crazy busy day, and I had to go. I pulled a chart, and it was a guy with left testicular pain. And I examined him, got the lab test, did everything. And he had an inflammatory process above the area of his concern. It was causing a lot of pain. And so I treated him with an anti-inflammatory and antibiotic just in case, and a referral to a urologist. And that could have been it and should have been it in normal traditional allopathic medicine. Here's an important thing to stop and think about for a second. The reason that could have been it and should have been it is because the science that underpins all of Western medicine is, you know, reductionism. Reduce it to some cell or molecule, basically. And that's it. That's the cause. And nobody ever wants to think of antecedent causes or contributory causes. It's a single blunt beginning and this endless series of ailments after ailments. Yeah. So I decided I'd ask my question that I got from thinking about Robertson Davies' brilliant essay. And so I said to him, I said, when we were all done, I said, hey, you're not going to know the answer to this, and I'm not going to know the answer to this, and let's not even pretend to know. But you could have had this thing like 2 weeks ago, or maybe even 2 weeks from now. I'm just curious, if you had to guess, why today? Just guess. Yeah. They always say the same thing. Oh, you're the doctor. Yeah. And I said, yeah, I know, but I'm not saying I know, and I know you don't. Just guess. And after that second, you can't say a word, because it might take, you know, a full minute for the answer to percolate up. And it usually comes in the form of a question. In this case, the guy, after he said, I don't know, you're the doc, I said, nah, just guess. He turned to me, he said, well, I don't know, doc, but you think this is going to get in the way of the vasectomy my wife wants me to get tomorrow?
Yeah, I think so.
So there's a noetic, mental, contributory cause. And we can well imagine in this case, this retreat into illness was the answer to that subconscious wish. Or maybe that was even a conscious wish. If you ask that question, why did they just guess, of everyone, and I use it in my office practice all the time. Patient I just saw, you know, this house is giving me so much stress. Well, why do you think it is? You know, you could have come with this complaint a month ago or a month from now. Why today? What finally got you? Just guess. it cracks open the lid of all these deeply, often buried psychological causes that you then have access to. And so what I've learned, this takes, nobody has to believe me on this. All you have to do is ask this question after you've made the diagnosis and then come to your own conclusions. But after decades of asking this, I can tell you that there are discrete categories of answers that are recurrent in the human herd. Often there's a retreat into illness, a wish to get out of something. And that's a conditioned response from your childhood tummy ache that got you out of an oral report, or your childhood earache that got you out of a test or away from a bully or whatever it was. And you got, lemonade and ice cream and cartoons, and that's a heavy reinforcement, mother's love, good boy. And before you know it, you've got a stimulus response pattern all set up, and that travels into adulthood until we as hypnotherapists interrupt it. Dangerous identifications with mom or dad that should stop at a certain time, young adulthood, but tend to go on far too long. Retained childhood misunderstandings is very common. I treated a girl just recently, for example, beautiful young lady. She'd seen 8 specialists, had a $238,000 workup. And she had this refractory abdominal pain every single meal. After she ate, this pain would hit her in the middle and go straight through to the back. And nothing you could think of materially was discoverable. But I asked her the question, I said, well, let's say you could get rid of this thing. You could have got rid of it 2 months ago, 2 months from now. I'm not going to know. You're not going to know. If you had to guess, why do you still have this? Why now? Just guess. And think of this. Here's what came. First thing she said is, I don't know. I feel like I'm just afraid of vomiting. And so then I thought, okay, I'm going to seize that. What's the worst thing that can happen? And she said, well, when I was little, really little, I can't even remember when, I heard that if a baby has the cord wrapped around them at birth and they vomit, it can kill them. Doesn't matter if it's true or not. That's her retained infant understanding, no upgrades. And it turned out she had the cord wrapped twice around her neck. And, a child doesn't know, maybe there's a time limit on that. Maybe that's wrong. Maybe, the whole way of reframing it with adult understandings. So here's this beautiful young lady who's been plagued with this horrible ailment. And, all I had to do was address that. It took 2 sessions. And she came in on the 3rd session and I said, how was your week? She goes, it was a great week. Yeah. Why was it a great week? She goes, I ate 10 meals a day. I gained 5 pounds.
Yeah.
Right? It all started with why today.
Yeah.
The other set of causes is, which we've mentioned, of course, is curses. Somebody cursed them somewhere along the line. And guilt. I mean, guilt is, people may not want to hear this from certain places, but Judeo-Christian guilt entails punishment. And if people have bought that idea, if they've assimilated that idea, there's often an unconscious wish for punishment to assuage guilt. Why today gets at all of those things. It's a simple question, and it gives you a latch so you can lift that lid and get at the causes.
Yeah. And often I find that when you are working with people in that way, it's ready to come up. Have you found that? That when you ask why today, and then the information comes up, it's almost like it's been sitting there just waiting to have that question asked.
Yeah, I just had that today. A guy is 74 years old. I asked him why, and suddenly these memories of his mother come swelling to the surface, and buried in that was the cause of his problem. Yeah. Now, I don't believe myself that catharsis is cure. It is for maybe, I don't know, 2 or 3% of people, but I usually work at a different level, and tell stories in trance and watch people get well, sort of more organically, if you will. But it's nice to have a handle.
Yeah,
and
totally. Yeah.
Gives you that handle.
Yeah. And you mentioned just a couple back something about taking on, was it taking on parents? It wasn't taking on parent stuff, but to do with house. I think it was your second or third one. And do you know what I'm mentioning?
Say, I couldn't hear that one. Say it again.
Oh yeah. So when you were just going through the different things, the second or third one was around taking on, was it parental health information?
Right. So no, I call it dangerous identification. So everyone, there's no way to survive childhood without it's a necessary and essential survival tactic for all us helpless little mammalian kids. And the tendency, it depends on family structure and a lot of other things, but the sort of tendency is for at least first born girls to identify primarily with the mother, and firstborn boys with the father after a brief mother identification. And it mixes up as you go down the birth order, and you really have to learn how to find out who they identified with. But this is the most neglected cause in medicine, without a doubt. And most of I'd say 80% of my patients, in addition to other causes, there's often 3 or 4, but suffer from a dangerous identification at any age. I'll give you one just salient example. A guy come in depressed, and he was worried about himself, but not patently suicidal at the time. And I asked him, well, tell me what happened. What's the story of this depression? And he said, well, look, my wife and I were riding our motorcycle down the road, and I dumped it on the road, and she got off, but I broke my shoulder. Had to go to surgery and then rehab. I started to get depressed, and in rehab, while I was making my comeback, my business partner of 30 years absconded with $2 million, and my business was all but bankrupt. And so this is a story he tells me. And I didn't get it on the first session. The second session, I said, okay, well, tell me more about your dad. Is he around? No. Now, this patient is 72 years old when he's telling me this. Okay. Now, my dad died. Well, what did he die of? Well, he had a very bad, when he was 70 years old, very bad car accident. This is an important thing. We identify and mimic thematically, not in the particulars, but in the generals. So a car accident, motorcycle accident, it's a motor vehicle accident. He broke his back. Okay, he didn't break his shoulder, he broke his back. I don't care about the particulars. Now I'm starting to see something. He became, had multiple surgeries, became very, very depressed. This will blow you away how tight this was. And you have to think of the power of this identification to actually unfurl this way. Speaking now still of the father, he had his back surgeries, he was in rehab, and he found out that his business partner embezzled $35,000, at that time a lot, and he just couldn't take it. It was too much. A week later, he went out and shot himself in the head.
Yeah.
At that moment, you have to know you're not dealing with a depression. You're dealing with impending suicide, because this knot between these two, father, son, is tied so tight that he even picked a business partner who ultimately would disappoint. Yeah. Right? So I see this, that's a psychiatric one. I see this all the time in people who have chronic diseases, undiagnosable gray zone syndromes, all kinds of things. you have to know the thematics of the parent with whom they were identified with in order to make a judgment whether that's a contributory cause or not. If it is, I'm happy to say, it's easily fixable. It doesn't take, 3 sessions, 5 sessions, maybe, depends on their imaginative abilities. Because once the cord is cut, they have to imagine healthy solutions that they haven't done. They've just been programmatically sleepwalking through their life. But once they're free, and they have to start practicing using their will and their imagination and trusting their instincts and so forth. But in there lies the essence of a cure for many.
Yeah. And I love what you say about when you said once the cord is cut, they have to actually step into that space of seeing how they want it to be, or health, or whatever you said they're talking about, not just cutting the cord and drifting and cruising, but actually having that idea or using that imagination to create what they're wanting, I guess.
I mean, that was a big mistake I made in the beginning. I thought if I could get them to cut the cord, they'd be like me, Yahoo, I'm free, I'm going to go do what.
Yeah, but
Yeah, some people are that way, right? But a lot of people aren't, and I don't think it's a flaw. It's just in their nature. It's very frightening to be out there in a world of options and opportunities when your whole life has been run programmatically under the surface without you knowing.
Yeah.
And they don't realize the vastness, the infinitude of their options. And so it's good to walk them their first few steps out on this, plane of adult healthy choices until they get a taste of how glorious it is. And then once they do, they're on their own.
And it is like when you say having the choices, I think one of the big things that people tend to learn working with this way is the power of having the choice. Once you have the understanding, or once they see it for what it is, and then realizing they are the creator, essentially, if that's the word, but every choice they make is going to put them in a direction, whether it be a good, healthy one, or whether it be following others' footsteps, right? But bringing them to a place that they actually have choice, whereas it tends to be taken, they believe they don't. Yeah,
I've been forced to learn by my patients that I don't know what the percentage are, but a large number of people who are of adult age are still tightly identified with whoever it was, much often to their misery. I mean, of course, I see the ones who are miserable with that. If you got a great parent, you can just monkey see, monkey do and be happy. God bless you. But since you don't have your parents' fingerprints, chances are at some point, their path isn't going to be your path to happiness.
yeah,
But it's amazing how programmatically people tend to run when they're under that influence. And in those cases, what they take as their thoughts are often rationalizations for a programmatic decision.
yeah.
You're right. It's a very different shift.
Mm.
I don't mind holding hands with them a little ways, but I won't go far down that road because that road is choice, and I'm not making their choices. Otherwise, we haven't done therapy. We've just substituted babysitters.
Yeah. And I'm finding that feeling that they have, like I was working with a lady today where after working on stuff, she was able to go into different spaces of feeling healthy and not. And then I just asked her, what do you think your life would be like if you chose to stay in this feeling and make decisions based on not feeling good about yourself? And what do you think your life would be like, on the other hand, if you sat in that good space and started making decisions from there? Because at the end of the day, she's got the same history, she's got the same parents, she's got the same past, but there's two very different decisions that she could make in each moment based on her choice at the end of the day, right?
It's so funny, we're half a world apart and we have the same conversation in our offices.
Yeah, because it's choice.
Yeah, I always paint the choice to stay where you are. This person I saw today, for example, said, Well, it seems like it takes a lot of courage to go down that open road. And I said, well, let me show you it from my side. Come out here and stand with me and we'll look back at it together. Over there is a room with no windows and no doors. And it's dark inside. It's a gloomy box. You can go there where you've been and stay there.
Yeah, not very nice.
A brightly lit house that you enter, and every wall has a door and a window, and each door opens to a new path with other places to go with doors and windows, and on ad infinitum. To me, I don't know, making the choice for the gloomy box, wouldn't that take more courage?
And more energy.
But think of it. I mean, this shows the commonality, because we did the exact same thing today.
Yeah, I think you did it in a very nice professional way. I said to her, you know, that feeling that you've got when you're standing right there, that's going to give you a real shitty life. If you wake up with that feeling, you're not going to want to walk. You're not going to be nice to people. You know, that's not a good life. That one's pretty good. You know, which one do you want, really? Because at the end of the day, you choose how you feel, and you can get into that feeling in a second. You know, but it's your choice. I can't do that for you.
Yeah.
Yeah.
That you can certainly, once they're in trance and you have access in a way where your ideas become their ideas, you can help that choice along substantially.
Yeah, right. Yeah. I should probably change my language a little bit after our conversation, though, because that's a little bit of a curse if they choose to do the yucky one.
Yeah.
Oh well. Yeah.
Nobody chooses the lucky one when they really look at it from what Gruner calls third position. You're looking at that going, yeah, I don't think I want that.
Yeah, do you know, what was I saying to her today? You know, that one there, you're probably not very nice to your husband when you're in that feeling, right? You know, he's probably not very happy, but that one there, he'd be smiling away, because it was one of the things she was worried about. But it's when they get to actually see it from out there, they really see that they're actually in control, and that they are a part of their story. It's not just happening to them. They're not just, you know, they kind of get the power back to decide who they want to be, right?
Yeah, I think this whole business of personal sovereignty or agency is it's easy to talk about. Very few people actually fully practice it, and yet it's what offers the greatest opportunity for health and happiness. Unfortunately, the world that I live in, you know, Western medicine, there's a tendency to deprive people, even by virtue just of the institution, the building, of their sense of personal agency and sovereignty. And you'll see in the back of the book, in a little bit of a covert way, because remember, I'm talking primarily to caregivers. But what I do is I teach them that when you go to a doctor or a caregiver of any kind, you have to think of them as a vendor of advice and counsel. And just like any vendor, you have a roofer come, you know, look at your roof, and he goes, oh, well, I know it's only 5 years old, but you need a new roof. It's going to cost you $40,000. Well, the first thing you do is get another roofer, get a second opinion, you know, and don't trust that guy. And I think that's an act of personal sovereignty, and we should do the same in healthcare.
Yeah.
And I hope people listening do, because that's what will get you healthy.
Yeah, completely. Awesome. Wow, what a cool conversation.
Fun.
For people, we'll wrap it up now. So for people that are listening, you've given so many. I was going to say, what's your best, like, you know, best words for them, but you've given so much already. Yeah, is there any other little magic you want to share before we close off?
Well, I think let me just in a sense, this is the most important thing to know. I talked a little about placebo in the beginning. When you're doing hypnotherapy, you're using hypnotic method to offer ideas. to get those ideas to gather momentum with your technique. So ultimately they actualize. I do 1 or 2 cases a week of pre-surgical hypnosis, and chapter 11, which you're not at yet, but you will be, gives the entire script of what I do for pre-surgical hypnosis. Just very quickly, I'll say the last, one of the last cases I did, they're all remarkable. They all surprised me, even though I've been doing it over 30 years. I'm shocked at every case. Was a dear friend who had to have a hemicolectomy, half her colon removed for cancer, and the lymph nodes in the back of the abdominal wall scraped off, potentially very painful, and analyzed for tumor. She came in, we spent an hour and a half, pre-surgical hypnosis, and there are 3 cardinal suggestions that I give for all such patients. Keep your own blood. You know, you can't say don't bleed, so keep your own blood, keep every drop, perfectly dry field. Delightfully, you'll wake with delightfully surprising comfort. So much comfort, in fact, that when caring people ask, how's your pain? Do you want pain medicine? On a scale from 1 to 10, how much pain? Pain, pain, pain. The word pain becomes a trigger for even more comfort. Finally, really rapid wound healing, really rapid wound healing. And I usually use a metaphor to describe that. This patient was to have a 3 to 5 hour surgery. It lasted 2 hours and 15 minutes. No blood, things go faster. She woke and stayed pain-free throughout the hospital course, had return of normal, this is going to be hard for your medical listeners to believe, normal bowel function in 12 hours. 12 hours, she had normal bowel movement, was advanced to a normal diet. And she went home at the just beyond 2 days because the doctor who I know up at a local hospital said to me, could have let her go yesterday, but my colleagues would have criticized the hell out of me if anything had happened. Just unbelievable healing, no blood loss, everything. The point here and why it ties back to placebo is, think about it. Her sensory system, her healing systems, her vascular system, were all influenced by simple ideas that were put forth through the hypnotic method. Just as authorities present the placebo idea, if you take this pill, if you do this surgery, if you undergo this procedure or this process, then you will get well. And what does that do? What is going on? And the thing I think we all need to realize, first and foremost, is that that is a way of igniting our intrinsic healing capacity. Yeah. It ignites these powers within us that we all have, phylogenetic inheritors of this great capacity to heal. We all have it. Everyone is listening and beyond. And these words, which tend to layer on the volition of the patient as if to redouble it, power these systems to go to work. The flip side, of course, is a curse extinguishes that flame. Yeah. So if I were to leave the viewers and listeners with any one thought, it would be recognize that whoever sits opposite you asking for help has within them this flame burning, right? And your job is, number one, do no harm, do not extinguish that. Learn to talk properly. Learn the meaning of your words, and then offer healthful, salutary ideas so that that flame blazes hot and furious and drives them back to health. And I think that's what's going on for most of us who do care work of any kind. And like you, Justine, I hope more and more people will think about this and listen and read, and that our efforts on the part of patients will be much more wholesome and much less harmful in the future.
Awesome. Well, thank you so much for talking with us today. And I will share all of the all your information on the Spotify links, and this will probably go onto YouTube as well because it's such a cool conversation. Again, I think our members will listen to it over and over again. So thank you so much for coming today and speaking.
You're wonderful. I really appreciate it.
Awesome. Yes.